Focus on Health, your weekly dose of health and wealth information on KUTV.
Welcome to Focus on Health, where demystify matters health. My name is Bwari Michelle. World Pneumonia Day is celebrated every year on the 12th of November. And as Focus on Health, we'd like to create awareness on pneumonia. The theme this year is Stop Pneumonia because every breath counts. Joining us for this conversation is Dr. Catherine from Penda Medical Center, Kimathi Street. But even before we see Dr. Here now is the health update. Don't forget to hit us up on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. Also, don't forget to chat with Penda through the number on your screens. Championing the fight against pneumonia. Pneumonia is the single biggest infectious killer of adults and children, claiming the lives of 2.5 million, including 672,000 children in 2019. Deaths from COVID-19 will add 2 million more in 2020, bringing the total to more than 4 million. No other infection causes anywhere near this burden of death. Air pollution is the leading risk factor to death from pneumonia across all age groups. Almost a third of all pneumonia deaths were attributable to polluted air, killing around 749,200 in 2019. Household air pollution contributed to 423,000 of these deaths, while outdoor air pollution contributed to 326,000. That was a very informative health update, and with me on set is Dr. Catherine from Penda Medical Center. Thank you so much, Dr. for joining us today.
Hey, thank you so much.
So, Dr. how are you doing?
I'm good. How about you?
I'm well as well, Dr. Thank you for asking. So, Dr. our topic today is pneumonia, and every year we celebrate World Pneumonia Day on the 14th of November. And even for our viewers, you can join this conversation. You can follow us on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and also Health Focus on Instagram. And you can also chat with Penda. We're going to leave a number down below where you can tell us your comments, your queries on World Pneumonia Day. But even before we head down to that, even talk about the World Pneumonia Day, kindly introduce yourself to our viewers.
Okay, my name is Catherine Ithuli, Children's Health Quality Manager at Penda Health.
So, Dr. as now as we create awareness on this Pneumonia Day, tell us what exactly is pneumonia?
Okay, pneumonia is basically inflammation of the lung tissue, and I could expound this by saying it's any infection that causes injury to the lung tissue. Yes, the infection could be a viral, it could also be a bacterial, or it could be caused by any other causative organism, or even something like inhaling flames. Yeah.
So, Dr. what are some of the signs and symptoms that you should look out for when you're contracting pneumonia?
Okay, we have different signs and symptoms of pneumonia, and we have different signs and symptoms for adults and for kids. So for adults, the common signs and symptoms are we have shortness of breath, they may get fever, and they may also get chest pain and bronchial cough. That is cough that is producing a kind of mucus sputum.
Oh, okay.
Yes. Now for kids, mostly they will have fast breathing and they will have lower chest wall introing. That is, if they are breathing, you'll find that the chest wall is going up and down, up and down. That is lower chest wall introing. So if it gets severe to kids, they will also get things like grunting. That's producing a different sound when breathing. They will also get to have low oxygen levels that is characterized by looking blue. You find that a child, like the nose look blue. That means the oxygen levels are low. That means that this child has severe pneumonia. Some of those children will also be lethargic, like they don't want to be touched, they are crying excessively. Yes, and you find that like some of them still will have cough and they will look uncomfortable when breathing.
So, Dr. you've mentioned some signs and symptoms like the cough and the fever, and somebody will maybe, imagine that this is just your normal common flu. So how do you differentiate between pneumonia and common flu? And also, how do you differentiate between pneumonia and COVID-19?
Okay, so one thing that we should know is that you may not know when you have pneumonia because you can easily confuse it with things like flu. But you should know that flu can also cause pneumonia. So a flu is mostly upper respiratory, like it will affect mostly the throat and the nose. You'll feel like you are sneezing. But the time when you start getting difficulties in breathing, when you have a flu, you know that it's progressing to pneumonia, meaning that the organism has already got into the lungs. And then for COVID, you may have shortness of breath, you may have things like fever. So COVID, if it progresses to the lungs, it still causes pneumonia. So pneumonia is as a result of infection. COVID can cause pneumonia, flu can cause pneumonia, anything can cause pneumonia.
Dr. In your explanation, you've talked about viral and even bacterial infections leading to pneumonia. Is it because we have different types of pneumonia? What exactly now causes pneumonia?
Okay, we have different types of pneumonia. We have a pneumonia caused by virus, and especially those pneumonia caused by virus are self-limiting. Like they definitely, we don't have treatment for viral. We don't have drugs for viral infections. And then we have pneumonia caused by bacteria. And then we have other pneumonias caused by aspiration of. You can aspirate even like aspiration of things like paraffin. Things like fumes, they can cause pneumonia. So basically, anything that causes injury to the lung will cause pneumonia. And there are so many different causes. Yes.
Between the viral pneumonia and the bacterial pneumonia, which is more severe than the other?
More severe is bacterial pneumonia, because bacterial pneumonia needs treatment for it to go away. A viral pneumonia can go away by itself, but a bacterial pneumonia must be given, you must be given antibiotics. It must be treated. It can get very severe, very, very severe, until you need oxygen.
So Dr. now that we've talked about the viral pneumonia and the bacterial pneumonia, do they have different symptoms or do they exhibit the same symptoms?
Okay, they have the same symptoms. So when you get into the hospital, the doctor is one who can only tell you the difference between the two. Yes, they'll do a series of chest examination. They will do other investigations that they will be able to know that it's viral or bacterial. But mostly a viral pneumonia will just end by itself within 3 days. You'll start seeing signs of improvement. But a bacterial pneumonia will be more severe as you progress. Okay. Yes.
Dr. Now, at what point do you consider now going to the hospital and you realize that this is not just my common flu, it actually could be pneumonia?
Okay, there's a saying that says you better go early than be sorry. Anytime you feel that you have cough and you feel like you are having like shortness of breath, make sure that you visit the doctor immediately. Because you might be having pneumonia, and you should not stay to wait pneumonia to get severe. And especially for kids, if you find that the kid is breathing faster than normal, even if they have no cough, take them to the doctor. That's the first sign of pneumonia in kids. So you'd better go, let the doctor tell you that you don't have pneumonia than you assuming, because it's very lethal, like dangerous. Yeah, it can easily kill. Yes, because here we are talking about oxygen depletion in the blood. It's you don't have to wait. Yes.
Now, Dr. Let's head down to the risk factors. What are some of the risk factors that could increase your chances of contracting pneumonia?
Okay, we have various risk factors, and one of them is age. Children under 5 years, they have low immunity, so they are likely to get pneumonia, especially bacterial and viral. Adults more than 65 years of age, still the immunity is low, so they are likely to get pneumonia. And then we still have people who are smoking. We still have people who stay in overcrowded places, because overcrowding is one major cause of pneumonia, because it's a droplet infection like COVID. Yes, and then the other thing is hygiene, hand hygiene. If like people who do not wash their hands, you definitely will have to touch your face, and if you have the germs and you touch your face, you are likely to get pneumonia, because you just inhale the microorganisms that cause pneumonia, and they are very common and they are very many. Yes.
Wow, that's actually very interesting, Dr. Because you think that it's only COVID that you're told, okay, don't touch your face, but it's amazing that actually pneumonia can also be contracted the same way.
Yes, that's something that we should know. And not only COVID and pneumonia, most of the respiratory illnesses can be caused by poor hand hygiene. Because basically, you will not fail to touch your nose. Cindy, you still touch your nose, you still touch your face, so you are likely to get those microorganisms when you touch your nose or your face. Yes.
Dr. You mentioned something about the age factor, when you mentioned about 5 years and 65 years. Does it mean that in between you can't contract pneumonia?
You are still at risk as long as you are staying in overcrowded places. The microorganisms are very many. You are still at risk. Hygiene, you need to maintain hygiene to reduce the chances, but everybody is at risk. The only reason as to why I talked about children under 5 years and adults over 65 is because of the immune status. So those ones are at higher risk because the immunity is a bit lower as compared to the rest of the population.
Maybe, Dr. you could hold on to that thought as we take a slight commercial break, and when we come back, you're going to be guiding us more on the risk factors. So we are going to take a break. Do not move a muscle. Don't forget to hit us up on our social media platforms at KUTV Focus on Health on Facebook and also on YouTube, and Health Focus on Instagram. And also don't forget to chat with Penda. We are going to leave a number down below. So how many times have you gone to hospital and you've had somebody telling you go for the full hemogram? Do you know what it means? I particularly do not know what it means, but that's what we're going to be learning about in the Did You Know segment. The Did You Know segment. The Did You Know segment.
My name is Benjamin. I'm a lab tech at Penda Health Kimathi Street. Today we are going to talk about full hemogram test. Full hemogram is a hematological test which is used by the doctors to diagnose different types of illnesses. From the results, one can tell if it is a bacterial infection, viral infection, or a parasitic infection. So the machine which we use is the RUI BCC 3600. For this test, we need a blood sample. After collecting the blood sample, we put it on a roller mixer. Here, the different components of the blood mix. And then after we take the sample from the roller mixer, we run it using the full hemogram machine. So this one is a simple machine. So there is a probe which comes out of this place. You just open your vacutainer, and then you place the probe inside the vacutainer. The probe will suck the blood sample, and then the machine will analyze the results. The machine is quite fast. It takes less than even 1 minute for the results to come in. After the machine has run the sample, there will be a printout from this place. Yeah, and this is where you will get your results.